up. Yeah. All right, everybody, welcome to Revenue Subcommittee for Tuesday, March 16th, 2021. We will likely have at least, we're definitely going to have at least one more subcommittee meeting before crossover. That will likely happen this Thursday, but we will post on the website and share via our email distribution list the time when we've confirmed the bill list for that meeting. We have, I think, 5 bills that we need to take up today. We're going to start with the duly assigned bill. We are secondary on HB 463, the Maryland Health Equity Resource Act, to the Health and Government Operations Committee, who made a number of changes in the bill. And I'm going to turn it over to George to explain what their amendments do on that bill.
Thank you, Mr. Chair. In your email earlier, I had sent a reprint of the amendments as adopted by the Health and Government Operations Committee the other day. I would note at the outset that provisions of the bill concerning income tax credits, loan repayment, and alterations to the sales and use tax on alcohol had been stricken by those amendments. The bill now consists largely of 2 parts. Part 1 of the bill begins on page 3 after line 30. The new amended language would take effect immediately and establish a Pathways to Health Equity program in the Community Health Resources Commission. This part of the bill will be effective for 2 years, and the purpose of the program is to provide the foundation and guidance for a permanent health equity resource community program within the Department of Health. The program would provide grant funding to reduce health disparities, improve health outcomes, improve access to primary care, promote primary and secondary prevention services, and reduce healthcare costs in hospital admissions and readmissions. The Commission will issue an RFP for applicants with proposals for programs that address the above criteria and demonstrate how the program could be sustainable as a permanent health equity resource community. The Commission will also issue 2 reports to the Governor and Legislature, an interim report on or before January 1st, 2022, on the grants provided, and a final report on or before January 1, 2023, on the grants provided, options to develop, sustain, and establish a permanent HERC program within the Department of Health, cost-effective ways to measure an HERC, workforce and recruitment strategies to be used by an HERC, and any legislative recommendations regarding the HERC program. The first part of the bill would be funded through a Pathways to Health Equity Fund that is in the Commission and consists of the $14 million that was authorized for the Commission under the Relief Act. The first part of the bill is effective until June 30th, 2023. The second part of the bill starts on page 4, and I'll now proceed through the amendments to this section of the bill. The bill would establish the advisory committee. It will be established on or before July 1, 2021. The Secretary of the Department of Health would establish the committee to provide assistance to the Commission in developing the reports required under the first part of the bill, provide guidance to the Secretary when permanent HERCs are established, and identify long-term funding strategies for those HERCs. The advisory committee would consist of 9 members, consisting of representatives of 5 state agencies, 1 local health department representative, and 3 subject matter experts. The first 2 years of the bill, the chair of the Community Health Resources Commission would chair the advisory committee. After those first 2 years, the Secretary of Health would appoint the chair. On page 10, after line 3, the Secretary of Health would be required to convene working or advisory groups to facilitate implementation of the bill, and must include individuals who reside in an area that has been or may be designated as an HERC. After line 4, this would describe the entities that can apply to be permanent HERCs and require those entities to include FQHCs, or other community-based organizations that provide health or wraparound support services. After line 16, it describes what the application might include. On page 11, starting on line 28, beginning July 1, 2023, the Secretary of Health would be authorized to begin to designate HERCs. On page 13, this section of the portion of the bill is the same as introduced. For the remaining pages, page 23 through 23, sorry, page 13 through 23, those provisions which concerned tax credits, loan repayment, and alcohol tax have been removed. Reports from areas designated as HERCs remain in the bill. You can see that on pages 16 and 17. And lastly, the bill is an emergency bill because the first part of the bill uses the Relief Act funds, and the Relief Act was emergency legislation. The amendments were adopted unanimously by the Health and Government Operations Committee.
And then the bill passed full committee unanimously as well, right?
Correct.
Delegate Buckle, go ahead. You're muted. You're still muted. Delegate Buckle, you're muted.
Oh, I'm sorry. I keep clicking out. I hit the wrong button. So that's health policy stuff, which I completely embrace. The HGO committee said that's fine. I think I know the answer to this, but I just want to confirm it on the record. The elements that this committee predominantly had jurisdiction over, the raising the tax rate on alcohol from 9 to 10% to be the funding mechanism. I think you said toward the end there, that's been eliminated from the bill, and that the bill's funding mandates will be taken care of through other funding, which we now seem to be awash in for a variety of reasons, which that's great. It's a good idea. We're not paying for it by raising taxes. Is that correct?
I should have, by the way, before we started this, I should have said anyone who raises their hand on this bill is getting transferred to HGO. Because yes, the tax provisions were taken out. All that's left is the healthcare provisions.
Sounds good to me. Thank you.
After I said that, Delegate Long raised his hand, so I think.
Bob thinks next year we'll be back to committee dinners, and he knows where HGO goes, and he's like, I like Ruth's Chris, so
Yeah, that's fair. That's fair. Although, given they're the health committee, they should probably be eating quinoa instead of steak. But Delegate Polakovich-Carr, go ahead.
Yeah, and for the record, I raised my hand before you made that threat. So George, again, just to double check. So originally the bill had some enhancements to certain tax credits. The amendment struck all of that, and so now it's just a grants-based program. Is that right?
Correct.
Okay, thank you.
Any further questions on the amendments? Is there a motion on the amendments?
Move favorable.
Second.
All those in favor, raise your hand. All those opposed? Bob, I'm going to count you flickering on the screen briefly as you raise your hands. There we go. Okay.
Yeah, I'm for it. Yeah.
On the bill as amended, are there any questions? Is there a motion?
Move favorable.
Second.
All those in favor, please raise your hand. All opposed? All right. HB 463 gets a favorable report from our committee. We're just going to go in number order. So next up, we have HB 864, income tax subtraction modification, military retirement income. This bill came in as a way to create a special sort of exemption category for people who are 100% service disabled veterans. In order to manage the potential fiscal implications, we do have amendments drafted which would reduce the exemption in the bill from what was introduced at $30,000 down to $20,000, which is still higher than other exemptions. So it's half a loaf, but better than none. But I do believe there were some questions about the bill or discussion. So Delegate Polakovich-Carr.
Thank you, Mr. Chair. So I had a good conversation with the bill sponsor this morning. I was thinking about a potential amendment, and in running that past George, realized I just have really fundamental questions about the bill, because according to the IRS, disability income from the Veterans Administration isn't taxable at the federal level. So if that's not taxed at the state level, what does this bill actually do?
George, do you want to
are you able
respond?
to answer? Do you have anything?
As indicated in the note, it may increase the amount of non-disability pension income that could be excluded under military retirement income subtraction. But unfortunately, data on taxable and non-taxable income received by Maryland individuals is not available.
Okay, so somebody then who would say only have their disability income from the VA, right now they're not getting taxed on that. at the federal or state level. Is that correct? But someone who has other employment, and I was able to find some data where it does look like even people with 100% military disability status, are employed. So really, we're giving them a subtraction on their other employment. Is that an accurate analysis?
That's my understanding.
Delegate Feldmark?
So is there a distinction between disability income and I thought this was dealing with their the military retirement, which I thought the disability income was separate, but maybe I misunderstood.
George?
Is that?
Sorry, just want to review the bill
Sure.
language once more.
Yeah.
And so it is specific to their military retirement income, and they would be eligible for the greater amount under the bill if they have a permanent 100% service-connected disability.
Okay, but I guess I didn't realize I had this question until I heard Delegate Polakovich-Carr's question, but I guess that the disability income that a veteran may receive is still separate from their military retirement, right? It's in addition to. So I thought, so then I guess the tax exclusion that Delegate Polakovich-Carr was talking about sounds like would not be applying to the income we're talking about here anyway.
Yeah, I would say I'm not entirely sure how the disability income versus the retirement income is divided in its entirety. All I can say is that as drafted, the subtraction applies to their military retirement income. If they are receiving both types of income, then I assume that the disability income would be excluded at the federal level and thus would be excluded at the state level.
Why don't we, since there are a lot of questions about this bill, why don't we hold it over until Thursday so we can drill down a little bit into some of the details here and get some more questions answered. If you have questions about the bill, shoot George and I an email, and we will dig into it a little bit and see what answers we can get over the next couple of days. You're muted again, Jason. Sorry, Delegate Buckle.
Oh, see, I muted myself. You keep cutting out. I don't know if everybody else hears it too, but sometimes I don't know if you're leaning in a direction or something. You like get halfway through the sentence and it cuts out, and then you come right back.
Right.
It could be my computer. So why don't we go to the next? I'm just saying we're going to hold the bill till Thursday.
We're gonna hold it. Okay.
Yeah. Let me see if I can switch computers. George, can you go ahead and explain HB 865, please?
Sure. The bill effectively would increase the maximum aggregate amount of initial tax credits that the director of the Maryland Historical Trust could issue under the Historic Revitalization Tax Credit Program for small commercial products by $1 million. The impact is spread over 2 fiscal years, I believe, indicated in the fiscal note. $300,000 for fiscal year 2022 and $700,000 for 23.
So can you all hear me better now?
Yes.
So the bill as without the bill, essentially this portion of the fund, the small commercial portion of it is empty. There's no more money for it. I did ask the sponsor because it was over the fiscal limit. I asked the sponsor to go to Appropes, and the chair of Appropes has told me that they do have room in the budget for this specific credit. So that's where it stands. I don't believe, George, were there amendments? No.
No amendment.
So what questions do people have? For motion on the bill?
Move favorable.
Second.
It's been moved and seconded. Any discussion? All those in favor, please raise your hand. Any opposed? Of course not, because you all just raised your hand. All right. HB 865 is recommended favorable to the committee. We will go next to HB 1178, income tax subtraction modification, first time homebuyer savings accounts. I know Delegate Barnes had raised some potential amendments, which I think George has had drafted. Delegate Barnes, go ahead.
Yeah, George, you want to read the amendment?
Certainly. The amendments would provide that only a first-time home buyer could establish first-time home buyer savings accounts under the bill, and would prohibit an individual from being an account holder of more than one account. In addition, the amendments would require financial institutions to provide to each first-time homebuyer account holder information about homebuyer education and housing counseling programs and services. And lastly, it would require the Department of Housing and Community Development to conduct outreach to communities of the state that have experienced lower rates of homeownership regarding first-time homebuyer savings accounts and the subtraction under the bill.
So, Delegate Barnes, did you want to move those amendments?
Move favorable on the amendment.
Second.
Second.
Are there any questions or discussion on these amendments? Delegate Buckle.
I just had a question, whether it's on the amendment or the bill. Do the amendments, or is there any thought, or is it changing the fiscal structure of the bill, or is the fiscal structure staying the same way? So it's $5,000 per year that you can do the subtraction modification for up to 10 years, right? For a maximum of 50 in the account.
That
Correct.
is not changed by the amendments. And,
Okay.
Just by way of additional information, I know that there was a question as to whether or not other investment strategies beyond savings accounts would be eligible under the bill. And yes, that is true. They would be.
Okay. So if you put them in some type of an IRA or a structured investment vehicle,
Like a CD,
Advise
money
you
markets, also available strategies that could fall under the definition of first-time homebuyer savings account.
sounds good. Thank you.
Delegate Long, did you have a question?
Not a question, just wanted to say,
We can hear you. You're good.
okay, just want to say the amendments make this bill even better, because my concerns were you can actually have too much money to get some of these first-time home buyer programs. So with the additional education, I think it makes a better bill. Thank you.
We wanted you to be happy, Bob.
That's good.
Very wise of you.
Any further questions or debate on the amendments? All those in favor of the amendments, please raise your hand. Any opposed? Okay, the amendments are added to the bill. Any discussion on the bill? Is there a motion on the bill?
Move the bill as amended.
Second.
Second.
Been moved and seconded. Any discussion? All those in favor, raise your hand. Any opposed? All right, bill is recommended favorable. And then finally, HB 1342, Economic Development Partnership for Workforce Quality Programs alterations. This is a departmental bill. And I'm, George, I honestly just blanked on what it does. So you please chime in.
It would expand the purposes of the Partnership for Workforce Quality Program and eligible uses for grants under the program to include training for new employees.
Right. Thank you for saving me. Are there any questions on the bill? I mean, it seems like this is just kind of a technical thing. All right, I move favorable.
Second.
Second.
Any discussion? All those in favor, please raise your hands. Any opposed? Okay, that bill moves. And we are done for the day. Once again, we will definitely be meeting sometime on Thursday. I will get the time and the bill list out to members as soon as possible. If there are bills you have questions about, feel free to reach out to me. And otherwise, I will see you in committee.